Mr. Wilson, this section goes over Patient Bill of Rights and Responsibilities. So these will cover your rights as a patient as well as some responsibilities that you have as a patient with the agency. So you have rights and responsibilities, and we have rights and responsibilities. So we're going to take a lot of time and go over these items. If you have questions along the way or don't understand something, feel free to stop me. And if you want to highlight something so that you don't forget it, let me know that as well. All right?
Very good.
The patient or the patient's legal representative has the right to be informed of the patient's rights and responsibilities as a patient through effective means of communication. If the patient has been judged incompetent under state law by a court of proper jurisdiction, the rights of the patient are exercised by the person appointed to act on a patient's behalf. Mr. Wilson, this section is going to go over advance directives. And this is something that we have to do.
What are advance directives?
Oh, well, I'm glad you asked. Advance directive is a term that refers to your spoken and written instructions about your future health needs.
Are they required?
No, it's not required that you do it. It's required that I ask you about it. But it is something that you should probably talk with about your family. It's important for everyone to set up advance directives. Because if you don't have an advance directive and you're unable to make choices about your medical care or treatment, then the state decides who can do this for you. Now usually it will be a family member or somebody close to you, but it's best if you get that information written out according to your wishes.
Okay.
Okay? And advance directives in our state are things like talking directly to your physician and family, organ and tissue donation, so like on the back of your driver's license, living will declaration, or life-prolonging procedure declaration. There's an out-of-hospital do not resuscitate declaration and order, healthcare representative, psychiatric advance directives, and power of attorney.
Oh.
So you can see it covers a lot.
Right.
So I would recommend that you talk about these things and go over this section of the book with your family. And if you'd like, we could possibly get a medical social worker to come in and assist you with that. Or if maybe you have an attorney that you've used, you can talk over advance directives with them as well.
That's good.
Okay, great. This section goes over safety in the home. And you can see that there's several areas that deal with safety: lifting, fire safety, medication safety, hazardous items, equipment safety, oxygen safety, which you don't currently use, power outages, flood, lighting, earthquake, tornado. There's all kinds of areas. And so we'll go over that. It's important that your plan of care includes items that help to keep you safe at home. So I'll be doing some teaching about safety in the home with you as well.
Thank you.
Okay. Mr. Wilson, this section deals with infection control at home, and that's very important. I'm sure you noticed one of the very first things I did when I walked in today was wash my hands. And all of our staff will be doing that. We wash our hands the very first thing, anytime we come in contact with you, and the last thing before we leave your home. I encourage you to wash your hands as well. And in our book here, we describe the proper hand washing technique. Hand washing is the best defense against infections. You need to report any signs of infection to us immediately. So if you start to get a fever, you get a runny nose or a cough, please let us know that so that we can protect ourselves appropriately. We will maintain universal precautions. Have you ever heard of that phrase before?
No.
What that means is it's the prevention of disease transmission through the use of infection control practices with all patients. So we do this for everybody. It's not that because we think you're contaminated with something, we maintain good infection control practices so that we are protected and you are protected. So sometimes we may be wearing gloves, we may need to wear masks, or even gowns and goggles. All right? All right, Mr. Wilson, this is the patient emergency care plan, and we have it on a dry erase board, so if you don't mind when we're done going over it, I'd like to put it on your refrigerator so that you can have access to it easily and so that your family can see it as well. The items listed here in the gray square are things that we would want you to call us for. Those are things like you get a productive cough, or maybe you have a new congestion, like a new cold is coming on. Maybe increased shortness of breath, and we'll go through the rest of these items. But you can see there's a lot of things that we would like you to call us for at the office number listed here. At the bottom, in red, we have things that you should call 911 for if you have these issues, such as you fall and you break a bone, or there's bleeding, or if you have chest pain that medication does not fix. Maybe you have shortness of breath, so that's severe. If your family is unable to wake you, they should call 911. If you have severe bleeding or bleeding that does not stop, you should call 911. As well as severe pain that does not stop and any other medical emergency. We want you to call 911 for these items in red. All right, Mr. Wilson, we've done a lot of explaining and discussing, and so now it's time where we sign the consent forms. I'm going to have you read this first section here, and then each section after that I'll go over, and I'm going to have you initial after each section. That's just saying that you've read it and you understood it, okay?
Yes.
All right, so if you could read this first section for me, just so I can see how your eyesight is.
I acknowledge that I have been made aware of my rights and responsibilities as a patient, including OSHA's rights, and I understand them. The state home health hotline number, its purpose, and hours of operation have been provided and explained to me. I acknowledge that I have chosen this agency to provide home health care. No employee of this agency has solicited or coerced my decision in selecting a home health care agency.
Okay. Do you agree and understand that?
I certainly do.
Okay, if you could put your initials on that line there. Perfect. The next section goes over consent for treatment, and you are hereby giving permission for the authorized personnel of your agency to perform all necessary procedures and treatments as prescribed by your physician for the delivery of home health care. It says that I understand, which is you, the agency will supervise the services provided, and that I, which is you, may refuse treatment or terminate services at any time. And the agency may terminate their services to me, which is you, as explained in your orientation. You agree and consent to the home care plan and payment as outlined in this admission booklet. And that's what we've been going over. If you could put your initials there. And when we're done with your assessment, we're going to go back in and we're going to fill in how many times we're going to be visiting you, okay?
Yes.
The third section is release of information. This is about the notice of privacy practices that we went over earlier. It says that I acknowledge the receipt of the notice of privacy practices and was given an opportunity to ask questions and voice concerns. I understand the agency may use or disclose protected health information about me to carry out treatment, payment, or healthcare operations. The agency may release information to or receive information from insurance companies, health plans, Medicare, Medicaid, or any other person or entity that may be responsible for paying or processing for payment any portion of my bill for services. Any person or entity affiliated with or representing for purposes of administration, billing, and quality and risk management. Any hospital, nursing home, or health care facility to which I may be or have been admitted, any assisted living or personal care facility of which I am a resident, any physician providing my care, family members, and other caregivers who are part of my plan of care, licensing and accrediting bodies, and other health care providers in order to initiate treatment. And it says, I author release of information to the following persons. So this is who do you want us to talk about your care with. And if you don't want anyone, you can just mark none.
My wife and family.
Okay, if you want to just put her name there and relationship. And then your initials.